primary health care. And because many people do not understand what this program means, they are saying all sorts of things. And at least if there's a program and you do not understand, you have to research about it. You have to read more about it so that you will get a fair understanding of what the program actually means. The purpose of this free primary healthcare launched program is a transition remarks from a corrective system to a preventive system, enabling early detection and rapid intervention to save life before condition is worsened and become costly. I believe the explanation that I have given to you under the initiation of this program is clear to you now. But let's dive into the benefit, the impact of this program to our communities. You and I believe that there are several communities that are impoverished. A lot of people in our communities are living in poverty. So therefore, people in our communities will not be discouraged to seek for health whenever they are sick. Let me make a quick summary of this program that compared to the NHIS, so they do not understand why this free primary health care.
Primary health care is complementary to the national health insurance. It's not coming to replace it. It is coming to complement the national health insurance. So it doesn't mean that because the free primary health care has come, you shouldn't get a national health insurance card. You should still have a national health insurance card. But at the point of examination and treatment at the polyclinic level, at the health center level, at the CHIPS compound level, at the health kiosk level, you don't need your NHIS card at that point. You just need your Ghana card or any form of identification to show that you are a Ghanaian and you are a resident in that community to be able to access health care.
You know, the free primary health care is to detect early condition. A health personnel will find a preventive mechanism to prevent this condition to get worsened. That is a major purpose. That is the major reason why this program has been initiated by the president of Ghana. You know, and to also remind several places in our country that do not have access to health centers. So this program is to make sure that those communities will get access to health facilities.
Kura or this idea way Emma Yura John Dramani Mahama. Nipa kura kofa idea way ba say yenko fasa sa bobo ya o se pragia o se day emfa meye ambulance wo Ghana ha no. Me pese me hu nipa kura or this initiative we ba ye. Okotena as a cabinet meeting okotena.
We are all citizens. You want to develop this country. So when a leader make a decision towards the progression of our country, we have to support it. You know, people are saying that president has gone and buy tricycle and to be used as ambulance. This is not an ambulance, as the president has made our mind. So if you are MPP communicator and you are speaking against this, the president has made us to understand that this tricycle are not supposed to be used as an ambulance. It is the purpose that this tricycle will be used to travel to a distance places in our...
Understand something, ask. Don't jump to conclusion. Those tricycles are not ambulances. Those tricycles are meant for the health workers and the health volunteers to go from village to village for screening.
I said it earlier that there are a difference between the free primary health care and the premium on the NHIS. Someone may say that if I am on HIS or I am on the NHIS premium, so what is the benefit? What is the purpose of this free primary health care? We all should understand that there are limitations on free primary health care. There are certain conditions that the person may have that the NHI has to cover, but the free primary health care cannot cover. For example, if I have a headache and I get to a CHIP compound or a health facility, because I have my national ID or my national card, because it's just a common headache, I'll be treated without paying any money. But if in case I have my condition is more than what the free primary healthcare can cover, then it means that HIS card will have to cover a condition that the free primary healthcare cannot cover. So there are limitations. And the president has made this clear that it doesn't mean that you will not register or you not renew your NHIS card or you not renew your insurance policy. You have to renew it because there are limitations on it. There are certain conditions that when you take it to the hospital, your free primary healthcare or the free primary healthcare might not cover. So even though we are all entirely covered under free primary healthcare, but not all conditions that the free primary healthcare can cover. So you still have to have NHIS so that
primary healthcare is complementary to the national health insurance. It's not coming to replace it. It is coming to complement the national health insurance. So it doesn't mean that because the free primary health care has come, you shouldn't get a national health insurance card. You should still have a national health insurance card. But at the point of examination and treatment at the polyclinic level, at the health center level, at the CHIPS compound level, at the health kiosk level, you don't need your NHIS card at that point. You just need your Ghana card or any form of identification to show that you're a Ghanaian and you're a resident in that community to be able to access health care.
Free primary health care isn't only decision and initiation that this government has already taken, but a policy which is called Ghana Medical Trust Fund, where the government is encouraging all individuals within the country or outside the country to donate into the fund. And bear in mind, the government, the president, has donated 6 months of his salary into this fund. You know, what is the major reason why this policy has been taken? You know, it is to people who might not have that money to pay for their condition, demand huge sums of money. For example, when you have a kidney problem, you know, it involves a high amount of money. So how may I get to pay this amount of money? So the government has taken a decision that whenever any condition is worsened and a person is poor, cannot even afford it, then the government will support it. You know, that is the major reason why Ghana Medical Trust Fund, it is there. You know, this is how we develop a country. So if we might think that our party is not in power, so whatever any decision that the party who is already in power will bring, and we try to politicize everything, this is not how we progress as a country. You know, we have to reject what is bad and we have to support what is good. Let's do not politicizing everything. Whenever a decision is taken, let's scrutinize the decision. If it is good for us or if it is bad for us. If it is good for us, let's support it. If it is bad for us, we demonstrate against it. This is how we will progress. But if we think that the decision that the party or the government has taken, it is a benefit of the state, but rather we think that because we are opposite party of the party in power, then we supporting it, we might not come in power in next election or next two election, then it means that you yourself, you are doing yourself a doom. This is not how we progress a country. Okay, I'm off. Thank you.